Hi, this is a video to help navigate you through the process to get health insurance using the Connect for Health Colorado Health Insurance Exchange. Now, the very first step is to be sure and go through the step-by-step instructions on this web page. And we're going to begin with, very simply, determining the size of your household. What we're going to do with this is we're going to use this along with your household income to determine if you're eligible for Medicaid or for something called an advanced premium tax credit, which reduces the cost of your health insurance coverage. Step one is just to figure out how many people are in your household. Certainly you want to include yourself, any spouse or unmarried partner who needs health insurance coverage, kids who live with you, anyone that you include on your tax return as a dependent for 2014, even if they don't live with you, and anyone else under 21 who you take care of and lives with you. You do not need to include unmarried partners who don't need health coverage and are not your dependents, your unmarried partner's children if they're not your dependents. You don't need to include parents who live with you but filed their own tax returns and aren't your dependents, and any other relatives who filed their own tax returns and aren't your dependents. Now, in terms of estimating your household income, just a quick tip, married couples must file jointly for the 2014 federal income taxes in order to qualify to get an advanced premium tax credit. So then basically what you're going to do is you're going to add together the income for yourself, your spouse, and any dependents that you're claiming who make enough money to file their own tax return. And of course, you do want to include obvious things like wages, salaries, tips. You can include income from your self-employment or business, unemployment compensation, etc. You don't want to include things like gifts, child support, SSI, veterans disability payments, or workers' comp. And also, one other thing, keep in mind that the household income is going to be based upon something called the modified adjusted gross income, which for most people is going to be the same as their adjusted gross income. And this is something that you're going to see typically. You may have seen this on your federal income taxes in the past. Keep in mind that if you are a business owner, if you're self-employed, this will allow you to deduct certain expenses. So you want to make sure that you're using the proper numbers so you can get the maximum benefit. And also keep in mind that the advanced premium tax credit ultimately will be reconciled when you file your 2014 federal income taxes. And I know a lot of people get kind of stressed out about trying to predict their income for the coming year, but please keep in mind that the exchange understands that life happens. Sometimes things may happen that could cause our income to go up or to go down in the coming year. In that event, you can call Connect for Health Colorado customer service and advise them that you've had a change in income so they can adjust that advanced premium tax credit on the fly, and that way it'll not have too much of an effect on your federal income tax filing when you file your taxes in 2014. Now that we've determined the number of people in the household and we've estimated our 2014 household income, please go down to step 3 and we're going to take a look at this chart. Now in Colorado, if you look at we have these numbers, 100% to 400%. What these percentages mean are these are percents of the federal poverty level. And in Colorado, if your income is relative to the household size is below 133%, then you're going to qualify for the new expanded Medicaid through Obamacare. Now, because of Obamacare, a lot of people are going to qualify for Medicaid that have not qualified in the past. And Medicaid, at its essence, is basically free health insurance. So it's tough to beat free. So if you qualify for that, That can be a very attractive option. Of course, you do need to be sure that you have access to providers that take Medicaid. And also many people often ask us, well, what if I qualify for Medicaid but don't want it? Well, you can still get health insurance through the exchange, but if you're eligible for Medicaid and don't choose to accept it, you will not be eligible for any of the advanced premium tax credits. Now, for people whose income falls in the range of above 133% and below 400%, for the number of people in their household, you are going to qualify for the advanced premium tax credits. And just like the name sounds, these advanced premium tax credits are money that is paid in advance and literally reduce the amount of the health insurance premiums that you would pay for. So as an example, if somebody had a health insurance premium that was $400, and if they qualified for a $100 advanced premium tax credit, the amount that they are going to pay the insurance company is going to be the net amount of $300. So again, if you're between 133% and 400% of the federal poverty level based upon your household size, you should qualify for these advanced premium tax credits. Now, the next step that we're going to want to do is, in step 4, is you're going to click on this link, and this will take you to the page to either register for Connect for Health Colorado, or you can also log in. And you can see we have these options right here. And then you would come to this page, this My Account page, which is the default page. Now, before we get too far, I'm going to ask that you add me as your agent with Connect for Health Colorado, which only takes a moment. You will select the Get Assistance menu, then you will select the option Find Expert Assistance in Your Community, and then we're going to select the option for Agent and Broker. And very simply, all you need to do is type in my agent number, which is 423-914. Again, 423-914. Then you'll click on search. You're going to see my name. And then you can simply click on the authorize button. And then it will have us select a period to authorize from. And we can go ahead and select the whatever today's date is. And then for the date 2, just pick some date far out in the future, please. And we will go with January 1st, 2016. Then go ahead and select the Authorize button, and that's all there is to it. So the very first thing we're going to want to do is simply to click on this Complete Eligibility. Now it's going to ask us a couple of very simple questions here. Well, first we have to agree to their privacy statement. And if you believe that you're going to be eligible for Medicaid, or if you believe that you're going to be eligible for an advanced premium tax credit, then you're going to answer the yes question here. Do you want to find out if your family can get help paying for some or all of your health insurance? Now, if your income is too high to qualify for an advanced premium tax credit or for Medicaid, you can simply select the no button here, and then you can progress forward and simply shop for the plans. Now, for most people, though, that are going to be eligible for Medicaid or for the advanced premium tax credit, they're going to select the yes option here, rather. And then it's going to ask us if we've been denied Medicaid or CHP Plus on or after October 1st, 2013. Now, for most of you who are just starting, the answer to that is going to be no. And then what you're going to do is it will redirect you to the PEAK system. Now what's going to happen is you're going to have to apply for Medicaid, and one of two outcomes are going to happen. You will, in fact, let me go ahead and just select this here. When you apply for Medicaid, you're either going to be approved for Medicaid, in which you get the free coverage, or you're going to be denied the Medicaid. Now, if you are denied the Medicaid, you're going to get a denial code from the Colorado Peak system. Then what's going to happen after you apply for Medicaid, and those of you who are denied Medicaid, you're going to come back to this exact same screen, but this time we're going to change our response from no to yes. And then we're going to enter in the Medicaid denial code, which is a 7-character value that begins with 1B, and it's a combination of letters and numbers. Then you will simply enter in your information, this Medicaid denial code here. Then you'll select the blue button to begin the application. And this actually is where you will complete the application for the advanced premium tax credit. And now you're going to be asked about the forward-looking 2014 household income. Now, after you've gone through and completed the application for your advanced premium tax credit, for those of you who qualify, when you go to browse the plans after completing that, then you're going to be able to see all the health insurance plans with the net amount, with the reduced premiums, so you can see what your true expected out-of-pocket costs are going to be for the health insurance premiums. For now, though, we're just going to skip ahead and we're going to just browse at some plans here. So I'm just going to put in some simple information very quickly so we can just take a look at what the screens are going to look like. And that is fine, and we'll leave it at 1114, and we're only going to look at health plans. And so now I'm looking at the plans, and these are going to be the cost for the plans without the advanced premium tax credits, because remember, you have to complete that in order to see the net amount. So by default, these health plans are going to be sorted from the least expensive to the most expensive. So you can see in my particular case, Kaiser has the lowest cost plans. So of course the lowest cost plans are also going to have the highest deductible. Now on the left side, you'll see we have the ability to apply some filters where we can look at plans with a range of insurance premiums, and we could also apply filters for deductibles, for out-of-pocket maximums. We can also apply filters to only look at specific carriers, and you'll see these are all the carriers that are available in a typical Metro Denver zip code. Now, if you live outside of Metro Denver, you're probably going to see fewer carriers available, and perhaps some different ones as well. One of the more significant things that you're able to do with the filters is you're also able to look at plans by metal level. So the most expensive and benefit-rich plans are going to be platinum, then gold, then silver, and bronze. Now, by the way, for those of you who have a household income that is between 133% and 250% of the federal poverty level, you will have a special benefit available to you where you can actually qualify for reduced deductibles and out-of-pocket maximums. But again, the only way that you're going to be able to see what those reduced deductibles and out-of-pocket maximums are for you to complete your application for the advanced premium tax credit. But anyways, if you are in that range, please be sure to take a look at those silver plans, because those may be especially attractive for you. Now, you're going to see a lot of names that you're very familiar with, but don't assume that the networks are the same as the networks that you may be familiar with in the past. And in fact, one of the things that's particularly useful about the website is we do have the ability to look up providers to see what plans they participate in. So there is Dr. Jonathan Zonka, and what we're going to want to do is we're going to select the provider, and then you're going to select on More Info. Now when you go to More Info, you can see his phone number, where he went to college, and so forth, but most importantly, we can see what networks Dr. Zonka participates in. So anyway, so this is particularly useful. Then you can go back to go ahead and look up other providers and add them to your list. And then when you're done, you can go back to the plan list. Now, if you're in very good health, you may want to just look at the least expensive options. And you can see, by the way, now a filter has been applied to where it's only looking at plans that Dr. Zonka participates in. And you'll see that Kaiser is gone because Dr. Zonka is not part of the Kaiser provider network. So anyways, now we can see those. And if we want to remove that doctor, maybe if we're not married to a particular provider and really just want to go with the lowest cost options, we can simply select that option. And then matter of fact, we can go through and reset all of the filters. Now we'll see that Kaiser has appeared again. Don't just look at the deductibles. Also keep in mind these annual maximum costs are very significant. In fact, you're going to see that pretty much all the bronze plans are going to have annual maximum costs of $63.50. So keep that in mind when you're comparing the different plans. By the way, you also have the ability to go through and compare up to 3 different plans by checking that box, and then we can look at them side by side. And this is quite a useful tool. Then we can go through and we can take a look at things like provider office visits to see if there are copays. We can look at the prescription drug coverage. We can also, one of the most important things also is to look under facilities, because under facilities, that's where you're going to see what the coverage is for things like outpatient surgery and inpatient hospital services. And again, if you go back to the general details, you can see what the deductibles are and the all-important out-of-pocket maximums. And again, that's for most of the bronze plans, that's going to be at $63.50. Anyways, after you've completed the application for your advanced premium tax credit, you'll see the monthly premiums will be net the amount of the deductions, and then we can simply select a plan that we want, and we can add it to the cart, and then we can simply check out. So anyways, I hope you found this YouTube tutorial helpful in your quest for finding the best health insurance coverage for your needs. Thank you so much.